we have our lovely panelists with us. On the end, closest to me, we have Reagan from Dental Hygiene. And then we have Jared, an intern from Health and Wellness Center. And we have Josh from Health and Wellness Center. Then we have Danny from the Dental Hygiene. Then we have Sarah from Nursing. And Summer, she's the senator for the Health Sciences School, and she's also a CNA, and she does a lot of cool stuff like that. And on the end, we have Rob, and he is from the Nursing Association as well. And our moderator is Tatiana. She is a nurse at the Health and Wellness. Oh, she's a program manager. And we would love it if you gave her your respect and your attention and your time. And thanks for coming out again.
Thank you. So today we're going to be asking the panel 4 questions, and then we're going to turn it over to you all to ask them questions if you'd like. Okay? So whomever would like to chime in, just a reminder just to speak into your microphone when you speak. Okay? So our first question, what is most challenging to you as a health student?
Hello? Yep. I think for me, just trying to manage my time between work and coming to school and then having the time to study. There's a lot of reading involved and that type of thing.
I would have to agree. My biggest problem is my time management because I'm involved with so much. Like she said, I'm your student senator. So I have multiple hours that I have to do that during the week, and then I have 18 credit hours of school, homework on top of that, working up at the University of Utah Hospital. So I'm back and forth everywhere. So mine is also time management.
Okay, I agree that time management is the most difficult part. What I found that works best for me is at the beginning of the semester, for nursing at least, you have to figure out when your clinicals will be, when your labs are, everywhere you're expected to be, because you can't miss these things or you will fail. And so you put them down on your calendar, whether it be like in your phone, digital calendar, or in your written calendar, and just put all those down, and then at least you have the things you have to do. The rest you can use for studying, or just when you get that done, hang out with your family. But it seems like the problem is when you're in nursing school, people kind of wonder if they aren't really close to you, why you aren't hanging out with them. You'll be putting a lot of time in.
What I have the hardest time problem with is utilizing my study time and not procrastinating during the time I'm supposed to study and then freaking out later. So I have 2 kids at home and a husband and a job and then go to school. So I have scheduled my days and stay at school for 3 hours after my classes and actually study and stay here rather than going home where there's distractions and television and all the things that you'd rather do.
Okay. Is this working? Okay. So it really depends on which time you were to ask me this, because in the beginning of my undergrad, I easily would have said time management. But once I kind of figured out, good study habits and figuring out, what times are going to work, and able to kind of get that sorted out, it kind of became a non-issue. But now, finances. I'm getting to the very end, and financially things are just awful. So I would definitely speak to planning ahead and knowing what you're getting yourself into, because once you get down to however long you're going to school for, the 4-year-old, 6-year-old, or even longer, know what you're getting into financially, because that could easily play a fact at the end.
Yeah, good point. With Josh, we're both in the same graduate program at the University of Utah studying mental health. Not to reiterate, but obviously time management is most important, but kind of more personal. Anybody who, if you're thinking about doing mental health, be prepared to do a lot of self-reflection, because you need to know yourself in order to help people know themselves. So a lot of self-reflection, which was what the hardest thing for me, and to overcome biases that I have and other things like that to work in mental health was the biggest struggle that I had.
I would say the biggest struggle I had is learning all the new medical jargon and words and terms, and just being put into this situation where I personally didn't have any background. Danny, she had worked in a dental office or dental setting before, so she was kind of familiar. So as it goes along, you know, you kind of catch on, but that was for me, just really getting into the groove of being in a medical field. That was mine.
Perfect, thank you. Any questions on what is the most challenging as a health student? Our next question is how do you balance school, work, and family?
I guess the thing that I did was turned off family, and then I just do school and work. So that's the one thing with the nursing program, is that it does require a commitment, and you need to let the people around you know that, and they have to kind of understand that, and hopefully you have a supportive background like I do, where they understand that I don't have a lot of time for anything other than school or work while school is going on. So they kind of entertain themselves, and then we all know that in about 72 days or so, who's counting, things will change for a little while I'm out of school for a minute.
The best way for me to manage between school and work and my family is writing out all the things that I need to do, writing out my goals, using a calendar. Like she was explaining, it's easier for me to keep a planner of the things that I need to do. Then it's right there. I check it every day. That's not usually a problem for me. But I usually start and end my day with seeing my family. I usually see them before I go to school, before they go to school or work. And then at the end of my day, I get to come home to them, do my homework with them, visit with them, tell my dad how my day was. But this is like my third semester in school, I've learned better ways of managing my time. And what has worked best for me is the way that I schedule my school and my work. So I schedule all of my classes in the morning. That way they're done. And then during the day I could do my homework, and then at the end of the day I can go to work. But I try not to schedule work so much because I have so much going on with classes and homework and being your senator. That involves a lot of work for me as well. So yeah, that's the best way for me, is just writing it all down and figuring out the best times that work. If I know that there's going to be a day that I'm going to have extra stuff going on or that needs to be done or events that are going to be happening, I make sure I don't schedule myself for days for those that day for work. So I have learned to better manage my time that way.
Okay, so I have a son. In the day, I do school, and then after that, I spend time with my son because, well, it's hard because I feel like I'm neglecting him, but I spend all the day when I'm not at school with him. But you have to try and manage that so you don't feel like a guilty parent. But then, so I do a lot of my studying at night. But I think more important than when you study is that you're doing concentrated study, that you're not distracted and not really focusing, because you could spend hours and hours doing not so concentrated study, like if you had a show playing or something like that. But if you do concentrated study, it's going to be more effective. You'll do it for less time. And it's important to take meaningful breaks, though, like with your family, or just get things you need to done.
So I have a 3-year-old and a 6-year-old, and I have a master calendar in my study with color-coded markers, and everything to do with family is in blue, and my school is in red, and everything else is in black. And so my kids know on red days they can't bug me, and they need to go play with themselves. And then we make a special date once or twice a month where I make sure that I don't have to study for exams the next week, and there's no important clinicals that are in the way, where we go out on a date, we go bowling, we go to the park, where you spend specific time with them when you're not thinking about studying, work, or anything else, to give them that individualized attention so they're not as upset with you.
Okay, so I think it's important to know what your social supports are and what you have in place because you're going to rely on them quite a bit. I'm lucky to have the wife that I have who has been there for me through this whole ordeal, which has just been, I don't want to say a nightmare, I don't want to discourage everybody, but it's been very difficult. Also, it's really important to take time for self-care. I'm sure Jared will talk to this too, and if not, now he's going to. And being able to take care of yourself, because if you're not taking care of yourself, then it's really difficult to keep your head in the game and your studies. So make sure you are taking care of yourself and setting that time aside for family, but knowing that which social supports you have to kind of rely on. I've been lucky, I've got a twin brother, and so all of my friendships he's kind of kept in check for me, and been there, filling my role, and my wife's been very, very understanding in the hectic schedule we have. So, just understanding those social supports.
Yeah, self-care.
Yeah.
No, obviously that's really important because Josh and I are now near the end of our master's degree. So we've been in school for a very long time, and you get burned out very easily. And oftentimes, well, just speaking for myself, is you kind of lose that journey, and it's the journey that's most important than the end. But it's hard because you have, all these other responsibilities in your life. So self-care, very important. I think just to add to what everybody is saying, is if you find yourself in relationships that, do not support your values and goals, education goals, then you should probably reevaluate those relationships, because you want to surround yourself with people who are going to support you, even if it's just as basic as your friends know that you need to study on the weekend, so they might not bother you to come and hang out and other things. So just kind of simple relationships like that to support you and to know that you're going through a hard time. School is not easy, stressful, and so any social support is important.
I would have to agree with everything. I have a planner. I have a set school schedule. I have a set work schedule. My work knows that I have to cut back sometimes, that I do have to take days off work. So that's really nice that they were very flexible with me. I'll also bring, little flashcards, little pictures on my phone that I can study while I'm on a little lull at work. And I'd take a night away from studying for myself just to be with myself, do whatever I want, hang out with my family, hang out with my friends, just take a minute to breathe and not be so stressed and worried about, oh, well, I have to be here at this time and here at this time, and I have to get this assignment done. Just to breathe and relax for a minute.
Thank you. What would you say to a student who is interested in the health field, or particularly your degree?
I think the number one thing is, like we've said, the commitment that's required for nursing anyway. It does require a commitment. And I think the things that I've seen people struggle the most with is when they don't really show that commitment or desire that's required to get through the nursing program. And then with regards to calendar, like I never really used a calendar before I got into school, and especially the nursing program, but make sure you just have one calendar. Having several calendars can actually create a whole different kind of problem. So get one calendar, get everything on the one calendar, and realize the commitment that you're making, and then stick with it.
I think that if someone was interested in the program, I would definitely make sure that that's something that they're interested in. The medical field is a really hard field in different ways, because there's so many different parts and different aspects of the medical field, with dental and physical therapy, mental health, nursing. There's so much that goes into it. There's so much knowledge that we need to know, and so much information that we need to attain. And I agree, you need to be able to be committed to that. You need to be able to know how to better manage your time so that you can find time and schedule time for studying and time with your family and for work and for school. And the other thing that's very important, the medical field takes someone that is dedicated, someone that's going to care for these people that they're taking care of. You need to be a people person. Working at the University of Utah, their biggest thing, if you're interested in working at the U, this is good information, their biggest thing is empathy. Being able to recognize what that person is feeling, what that person is going through is really important. You may not understand the exact pain that they're going through, but you need to be able to understand that that person is in pain and that you're specifically there to take care of them and to comfort them and to help them feel better. So I think that's really important. Those are the two most important things to me with the medical field.
Okay, so I might take a little bit different of an approach on this, but I think if I were to talk to someone about going into the nursing, I would say just know that you shouldn't do this on a whim, but you're going to have to work hard, but it will be totally worth it. Right now, after many years of work, I'm doing my capstone, which is like a final internship pretty much, and I love it. It's my dream job. I'm at the NICU at Jordan Valley, and I just love it. And I love nursing, and I would recommend it if you're willing to put in the time, because there are so many options with careers you can do. You could work for health insurance agencies. You could track down fraud. You could work on a floor at a hospital. You could work in a clinic. You could be a nurse educator. There are so many different things, and you are not limited by those options. And also, you have more flexibility with your schedule. Some do the 9 to 5. Some you can work the night shift. Some you can work the day shift. You can have full-time as 3 days a week or part-time as 2 days a week, which gives you a lot more options with your family. So for me, I'm making sacrifices right now, but it's going to pay off in the long run for me in a lot of ways. It's an investment for my family. And I can get paid better than I would at a lot of other jobs for the work I'm doing. And another important thing to consider is that you're making a difference in people's lives and in your community. And as nurses and student nurses, we always look at our patients in our community, and we need to look at how we can make them a better place for all of us. And so there's that aspect of the job too, that you are doing a good thing for the world.
For someone who is interested specifically in dental hygiene, I would just say to put your toe in the water. Go shadow at your dentist's office. Most of them are usually pretty nice about it. Make sure you're actually interested in the subject. You literally are cleaning people's teeth all day long. That's what you do. I could talk about teeth all day long, and I think it's really interesting, and I've been in the dental field for 7 years already, but you know, it's good pay. It's only 2 years. You guys, sorry, you have a master's. It's flexible hours, like it's a good job in general, but if you're not interested, or if you don't want to clean plaque off people's teeth all day, and you think it might be mundane after 10 years, then it's probably not for you. Granted, there's other things, you know, understanding oral pathology, recognizing cancers, educating patients. I mean, all that helps cut through the mundanity of it all, but that's literally what we do all day. So just make sure you have the longevity to be interested in the subject you're going to study for the rest of your life.
I'm going to completely agree with that. To speak to the nursing students real quick, my wife's a medical assistant and she hates it, and she wanted to go into that field, and now she knows I'm not going to put all this time and money into school doing something that I don't enjoy. And so it's the same with mental health as well. Is I know a lot of people that get burned out very quickly, and they see client after client after client, and then they take their problems home with them, and then they get completely burned out. So know what you're doing before you get into it. If you can volunteer, get some sort of experience, I would very much recommend doing that. On top of that, if you're thinking about going into a field that requires a master's degree or any type of graduate degree, you're going to want to have some sort of field experience because they're going to look at that on whether you get admitted in. That being said, if you are going into like a master's degree, understand that it is extremely time consuming to get everything, all of your letter of recommendations and everything that goes in order, writing all of your different papers and things getting in. It's almost like a 3-credit class for, you know, about a half a semester. You're going to be doing a lot of preparation prior to that, but it is literally like a 3-credit class. And I know that the program that, you know, both Jared and I went into, there's a deadline, and the deadline is set on Eastern time. So now you have 2 less hours than maybe you thought you had to turn it in. So be prepared for that. And if you think, oh, it's not going to go to the last minute, think again. It could. You've got 4 letter of recommendation writers. You're not choosing when they get that done. You just give them the deadline. There's a very good chance that they're going to be playing that deadline too. So keep that in mind.
So don't procrastinate or wait for the last second, apparently what you did. Maybe a little different approach, because I'll probably just reiterate what everybody's saying. I agree with everybody's saying. But if you have a strong interest in mental health, you know, bless you, because it is, of all the health fields, it's at the bottom of the echelon. It's if you go into social work, if you go and be clinical therapy, you're at the bottom, and that's something to be proud of, because you're doing work that a lot of health professions don't want to do, and you don't get paid very well. I know that's kind of a bleak statement, but it's something that I knew going into it, and it just matched up with my values and what I want to do in my life, and I don't regret it. I love every minute of my job. I wish it did pay better, but I wouldn't trade it for the world. So
Thank you. I'd also say, you know, a lot of the same things. Be interested, be dedicated. I am learning new things every single day that interest me. It's fun, it's exciting. It's not just school, and it's not just studying. It's learning about new things and how to apply your skills to every day. I enjoy people, and I enjoy talking to people, and you know, that's something you have to be interested in too. I'm sure that anyone who's interested in a health field is just generally a people person, generally enjoys talking to people, making people's day better, making them smile brighter. Yeah, that's what I'd say.
Thank you. I would just like to speak to this question. I got my degree in public health, which I feel you can pretty much do anything with. And I chose health education. So as a health educator and a program manager, I absolutely love what I do, and didn't necessarily thought health education was for me. I wanted to do epidemiology, but having a public health degree, I feel you literally can do whatever you want to do. And so if you're passionate about something, I love the college health population. I love what I do in helping young people. I teach anything from safe sex practices to stress management to eating healthy, diabetes education, anything you can think of, we do it in health and wellness. And I would just urge you to become passionate. If you're interested in something, if you have to work and you like to work, make sure it's something that you love to do, right? So thank you all. Rob, yes.
Loving what you do, that is really important. It took me 30 years to figure out that money wasn't like the number one thing, but that really enjoying what you do every day, that's really key to having a happy life and being successful. So as far as it not paying that well, that comes along as long as you like what you do. And I think that's a really important thing that you have to pay attention to, is make sure that you are doing something that you like.
Thank you. Okay, so our last question before we turn it over. Awesome. So our last question is, what do you think the college advisors or teachers have done or can do to support you and other students to be successful in your program? So that's kind of a lengthy one, so I'll repeat it. What do you think the college advisors or teachers have done or can do to support you and other students to be successful in your program?
I think probably one of the number one things that I think we've all struggled with probably, and we talked about calendars a lot during this panel. I think one thing the college and the advisors could do a little bit better is communicate what the schedule is going to be for our future, because obviously a lot of us are working and have families. I think the demographic at college is, changing over the last several years, where we're not, all of us aren't super young, and a lot of us have families and careers that we're already trying to pursue, or careers that we're trying to link in with what we're studying. And just having a schedule kind of set and out a little bit earlier. I know it's a monstrous task. I can't imagine what it takes to put all of that together, but that's the number one thing that I think would help me and probably future students, is having a better understanding of what the schedule will be before it comes.
I definitely have to agree with that. Thank you. A schedule would be nice. I think that they can all just be maybe a little more available to us. Like I said before, this field is hard. There's a lot that goes into it, and I think having them be available to us, to be willing to let us come to them for any questions that we have, or if we're struggling to understand something or struggling to finish something, that they're going to be there for us, that they're going to be patient with us and willing to teach us. I've realized that in the medical field, it's in the nursing program and working in a hospital, everything's super fast. We try and get things done, and the nurses are always super stressed and super busy, and so sometimes it's hard for them to just be able to stand there for a minute and explain something to you, because they have a set schedule. They have so much that they have to do, and so I'm very understanding of that. But then again, in order for us to be successful, we need to be able to have questions and be able to have people there to answer them for us. I think another good thing would be having them sharing their experiences with us. That kind of gives us a better insight of what we're going to be doing. Share their opinion helps us build our own opinions and our own likes and dislikes of that area.
Okay, so what I have really liked from some of my teachers, not all of them do it, but a good number of them do, is when I have instructors that you can tell are really engaged with what they're teaching, rather than just going through the PowerPoint, they go in and they actively discuss things with you. That helps me really learn it better. It also helps me when I've had classes, some of the nursing classes, where you're able to watch module videos online, because then you can augment your lecture with that. And I think also it's really beneficial if some of the instructors will discuss concepts that most of the group was missing on the test after the test, because that helps you kind of reinforce in your mind what you were getting wrong in the first place. So those are some of the different things that they haven't discussed that I think are beneficial and that more instructors could use.
Before getting in the program and getting your prereqs and your generals and everything else done you need to do to get into the program, to apply, take advantage of your advisors. I went after every semester, checked deadlines, see if they changed, made sure I was on the right track, make sure the same requirements for the courses were the same. That's your responsibility to be proactive. If they change a deadline and you miss it, that's your fault, and you didn't check in. Nobody's here to babysit you, and you need to be on top of your game if you want to take advantage of the availability in the programs. The teachers, I think all the teachers in our dental hygiene program are really awesome. They all emphasize that they're there to help you succeed. They're not there to make it hard for you or to trick you or to thin you out. They're there to help you understand the concepts, pass all requirements, and then go on and succeed and get a job. The one thing that I would like, and that us as first years in our program are doing for the next year's first years, is a little bit more financial information. we spend about $6,000 before we get into the program on our instrument kit and our books. And so then you take a big deep sigh of relief when that's over and you think, okay, I'm okay for next semester till I get my books. But you have to go to this meeting and you have to pay $100 to go, and then you have to join this club and that's $65. Then you have to donate to this club, that's $20. And all those hundreds of dollars add up so quickly after you just broke your bank and racked up your credit card that I think more information about things we need to go to outside of our classes. You know, they tell us the week before we have to go to a meeting on Friday and it's required, and I don't have school on Friday and I work and I babysit my niece, and you know, so those types of things that happen annually that they're aware happen should be told to us much more in advance so that we can be financially and prepared to attend.
Okay, there's nothing like ending on a negative note here, but I did not have the best experience speaking with advisors and things throughout the programs that I had attended. And so I guess basically that's what I want to speak to is take responsibility, know what you need to do, and if an advisor doesn't know or a teacher doesn't know, go find it yourself. I mean, don't have someone else or think someone else is going to take your hand, because they're not. And you know, I did my undergrad in psychology, so we have to take a class of, for psychology and like the field of psychology and what different careers are available and all that. And that class was an absolute waste of time for me due to the professor that I had. I had another friend who took the class, and he knew exactly what he wanted to do with his career because of that class. So it really depends on which professor you get, and due to that I got a really poor professor, I had to go figure that out on my own, which is fine, but I recommend that everybody do that for yourself and don't wait for someone else to tell you what to do or what you need to do. Take that responsibility on yourself.
Yeah, I would go a step further too with that and maybe put more light on your downer. Would be at the MSW program, we have a mentorship program where first-year students get connected with third-year, second-year students, and kind of help them, prepare them what the program is like. However, that mentorship program is optional, so not a lot of students take advantage of that. So if you find yourself in programs that have that option, I would, strongly suggest that you do that, because I think we can all experience in this room being students that a lot of what got us through school was our classmates. Excuse me. Yeah, I'm breaking up here. And so, our friends and our schoolmates, help us through. They tell us what professors to avoid, what professors to take, and other things like that. And just having that mentorship program there in place for faculty who are looking into doing that, I think is really important. I think that's it.
I feel like the advisors and teachers in my program have been wonderful. They've been extremely willing to help. And yes, the dental hygiene program is a lot smaller in number than the nursing program. So our teachers are readily available. We have time to practice, we have time to ask questions, we have time to perfect our skills. But the thing is, you have to ask. You have to send them an email. You have to say, I'm sorry, I'm not really getting what this question is asking. I'm not really understanding how to, do this task. And they're more than willing to help you. Same with the advisors at SLCC. I was well prepared as soon as I graduated high school. I knew that I wanted to do this. I went and spoke with an academic advisor here at SLCC and said, hey, what prerequisites do I need to do? What do I need to get done so I can apply for this program, so I can get into this? And I still can go to the advisors and ask them questions about, graduation, how to access something online. You just have to ask. You have to, they're there for you. You just have to know what to say and what to ask.
I thought of one more thing that's really important for students that would help them. So I think it's really beneficial that they have an advisor specific to nursing, because then he knows what exactly nursing students might be concerned about with transferring or completing their degrees and things like that. But also you can use DegreeWorks, and most of you probably know about it, but some of you, on the off chance you don't, you log on to your Slick EDU and go to the My page, and you can do degree works and put in what degree you're working towards, and it will show you what credits you have met and what you haven't met. And that actually is really beneficial, because then you can be a little more prepared and say, oh, I'm looking like I'm on track, I can meet with my advisor later. Or you can say, oh, what is going on with this? I need to go meet an advisor right now.
Thank you. We now want to open up the floor to you all to ask any questions that you have. So I just ask that you raise your hand and I'll call on you and you can state your question to the panel and I'll repeat it for our video purposes and then they'll answer it, okay? So you can answer however you want. Okay? Floor is now yours. Yes, ma'am. Okay. Okay, so the question was, thank you. Any prerequisites for the class, such as biology, dissecting things? If you don't want to do that, can you opt out of those types of classes?
I think there's another way for you to get credit for that type of thing, but as far as dissecting stuff in a biology class, you're probably going to run into worse stuff in the nursing field, so you may want to make sure you're okay with that kind of stuff before you pursue that direction. That's just my opinion.
I don't even remember dissecting anything in biology class. I really don't. But I do agree that you're going to have to maybe be comfortable with looking at, bodies and formaldehyde. But I can understand why that's a concern, though, because if you're, killing the frog, you might be upset with that. But I would think that there is a way for people to get permission to not do that. That would be a question for, I don't know, that the advisors or biology teachers, yeah.
Yeah, I don't remember ever dissecting anything, but if that's upsetting to you, the cadavers are probably going to be upsetting to you, and you probably shouldn't be there.
Any other?
You're more than welcome to switch over to mental health. You don't have to dissect anything there.
Yes, ma'am. Okay, thank you. So the question is, what made you decide to choose your field?
Oh, I'm dental hygiene. I have just went on my personal experiences. I've had a lot of dental work in my life, a lot of orthodontal work, and a lot of extractions and everything. And so I was just comfortable in that setting. And then I found it interesting. I was like, oh, what causes this? How can I fix this? And that's what ended me up here. It's just personal experiences in the past.
Yeah, for me, I kind of had an interesting road. I did my undergrad in pre-law, so I was on my way to law school. And then at the last second, I had a very good mentor of mine who even wrote letters for me for law school. Came up to me one day and said, you know what, law is just really not for you. And I was like, really? Because I think law is for me. But he said, no, it's not for you, so you should look into other things. So I started volunteering in a lot of different places, and I came to mental health through that way. And yeah, I just really found myself in mental health, and it just matched up to the values, that I have for myself and goals. And so that's how I got to mental health.
Okay, I'm going to try to make this as short as possible. I was not a good student in high school. We'll just put it that way. I never actually graduated high school. And so I ended up working construction. And there's nothing wrong with working construction. But when you've got this build, it doesn't work out very well. And it just was not for me. It was just really tough work. And so I thought, okay, I got to get my stuff together. I got to get to school. And so what am I going to go to school for that's not this manual labor? And so I kind of looked around and I saw like the relationships that my friends had with their parents, which was terrible. And my relationship with my parents was fantastic. And I'm like, why is this? And so I thought to myself, you know what? I want to be the person that helps bridge that gap for people, be a marriage and family therapist and have families come in and, understand that dynamic and help them work through their trials and their communication and, help give kids the chance to have a good relationship with their parents. And I know we don't live in this picture perfect world, and I'm not expecting to fix every relationship that ever walks in my office, but I wanted that opportunity, so that's why I ended up choosing mental health.
I have been in the dental field for, like I said, 7 years before. I started as an orthodontic assistant just for a decent job with some more money, and it was a short program that I took. And I just really liked it. I had a good experience with all the doctors that I worked for, and at lunchtime I would talk to them about new studies, and they would make me copies of their journals, and we would discuss treatment plans together. So it's probably because of the doctors that I worked for and because they were engaging to me and teaching me things rather than just polishing and cleaning and changing elastics, and that they actually helped me become more interested in my field, that I wanted to further that development and become a hygienist.
Okay, so I had a class project where we were told to think of a job that we wanted to do. Any job, no matter how outrageous it might have been, like, I don't know, showgirl in Vegas or a nurse. And so you were supposed to find someone who did that career and talk to them about it, see what a day in their life of the job is like. And so I talked to my friend's mom, who's a nurse that's a consultant for people who, when they have their babies, they consult them on lactation when they have problems like cleft palate or things like that. And I just loved how she described her day and how she was helping people, working with people on improving their quality of life and things like that. And so then I think after you decide that you're interested in something, take the next step and try out like a beginning level. So if you want to do nursing, you could start as a CNA. Maybe you won't like being a CNA, but you learn important skills. You can see what the nurses do and see if that's what you like. Or as you get into nursing, you'll get more hands-on with like all the different jobs you do, like with different clinicals and things like that. So I would recommend people take that approach. Just go, even on YouTube, find out what a day in the life of that person is like.
Sorry. Forgot what I was gonna say. My brain just stopped. Okay, I remember. So growing up, whenever I had like family in the hospital or in a nursing home or whatever, I was always asking the nurses like, why are you doing that? Like, what does that do? What does this mean? Or do you love your job? I'd ask them how much they got paid. Because when I was younger, I was like, oh, I want a job that's going to pay tons of money. I want to be rich. And, growing up, that's probably what a lot of you thought. But being older now and in college, I'm like, honestly, I just want something that's going to make me happy. But growing up and asking them those kinds of things made me really interested. I was like, this is really cool. And so in high school, as a junior, I went and got my CNA certification. And working as a CNA, my friends were like, why are you doing that? I'm like, because I love people. They're like, isn't it nasty? I'm like, it can be, but it doesn't bother me. I'm like, I love my job. I love helping people. I am a people person. The fact that I get to be one-on-one with that person and help them and be a part of their being a part of their progress is what is rewarding to me. Knowing that I was a part of their life and a part of that process of becoming better. Working in a nursing home, not in a nursing home, but I worked in a rehab center, and they're there only for a short time so that they can become better and go home. So being able to be a part of that and watching them become more independent and going home was so rewarding for me. I made an impact on that person's life, and that was what was important to me. I haven't I'm not in the program yet. I'm still taking my prereqs for the program. And I took my job at the University of Utah Hospital as a CNA in their resource. In resource, you get to work all over the hospital. You call in a couple hours before your shift starts, and they tell you where you're going for the day. I've worked at Huntsman. I've worked in the burn unit. I've worked in the ICU. I've worked everywhere. It's been great. There's still plenty of places I want to go. But this was the opportunity for me to be able to get experience in those different areas. Because I still am stuck on if I'm going to stay in nursing or not. So working in this position at the hospital has allowed me to be able to get experience in those different areas. Every day that I've worked so far, without fail, I have learned something new. And that is what's beneficial to me. That is what's helping me make my decision on my major, if I am going to pursue and stick with and be dedicated to nursing, or if I'm going to change it. I love the medical field, and I love the different aspects of it and the knowledge that I've gained and the skills that I've gained. And having that experience I know will be beneficial for me in the future, no matter if I decide to stick with it or not. The other thing I wanted to add was that getting my CNA before my nursing I thought was very smart. I worked with a lot of nurses in the hospital and in the rehab center that had zero CNA experience, and it was very frustrating. I wish that they would make it required. I think that they do, but there's been some nurses that I've worked with that don't have it. It's frustrating because they don't know how to help you. They can't help you lift. They can't help you do certain things. And so I think that would be more beneficial if more nurses would get their CNA certification, because then we can help each other out. And working with the nurses, we get to gain more knowledge of the things that they do, and they can teach us their ways and give us different aspects of the way that they do things. So, yeah.
So we're going to let Rob answer this question, and then we have time for a couple more questions, and then a few of the panel members can answer those. Okay.
So this dates me a little bit, but I grew up laying on my grandma's living room floor watching that show Emergency that's on like Cozy TV or whatever. I wanted to be like those paramedic dudes. They were so cool in '74. But I did end up becoming a medic in the National Guard, and that was my first kind of exposure to really the medical field. And it was very interesting to me, and I kind of picked up on it kind of quickly, and I really enjoyed that. When I came back from training, I got a job as a CNA, and I really enjoyed that job. I worked at a long-term care facility. The hard thing was that people never actually leave those facilities once they come. You get to know them really well, and then they usually pass away while they're at those kind of facilities. I did that for 3 years, and I always wanted to be a nurse. Like as soon as I got kind of exposed to the medical field, I wanted to be a nurse. And that first CNA job for me was the point that I realized how good you felt when you went home. Like it doesn't pay any money, but every night when you go home, you can generally count up something good that you did that day. And so that always felt really good. And I decided that it wasn't really paying enough money, and I got into a different industry for about 30 years. And that's kind of where the realization came to me about maybe 10 years ago or so, that you have to really kind of be happy with what you're doing. And so I came back to the nursing field. I wasn't a really great student in high school either, so I had to take a math class in the summer, and it was under 1010. So I had to kind of force myself into doing that. And once I found out that I could do that, you know, the next semester I took a math class and an English class, and I realized after doing that that I would be able to, you know, get the things done that I needed to do to become a nurse. So that's why I came back to it. But really, it's just generally, it gives me a good feeling when I go home, even from a really bad day, that I've done something somewhere to help somebody that day. Like you almost can't not do that when you're in this field. So that's the reason that's what attracted me to it.
Okay, thank you. We have time for one more question. If anyone would like to ask one. Yes. Okay. Okay, so our question is, what kept you motivated throughout school? And we're going to have a couple members answer this question, and then we'll conclude our panel.
So I think the thing that motivates me just is having the experience of not really enjoying what I'm doing and working at the hospital every day now like I do. This choice is validated for me almost every day. So that's one thing that keeps me on track. It's just the fact that I do want to do this, and there is an end point. It seems really far away all the time, but there is an end point, and you can do it. It's just, I look at it like a series of fiery hoops that I have to jump through, and you just try to keep, and only try to take about one semester at a time. Don't try to look so far down the road, because that'll crush you almost immediately, or me anyway.
Incredible Rob, fire hoop jumper. Bad joke. Come on, guys. Okay, so for me, it's just looking at the end goal. Okay, so you have the benefits of the flexibility of the job and the hours, and people keep saying nursing does not pay, but I think it's respectable pay. But I grew up dirt poor, where sometimes we were just barely getting by for a long time. But it is a respectable income. They say it's not a lot because you're not going to be rich like flying your own jet or anything, but you could support your own family if you had to. And that, for women especially, is really important, because if you are single or if you're part of a family, what if you have to be the breadwinner? That's important. For guys too. And I think IHC starts at like 22 an hour, is that right, for graduating nurses, if I remember right? And it varies by the location, but that is respectable. Whereas like when I used to be really experienced admin assistant or executive assistant, the best I would get was like 15 an hour. And you're putting in hard work, but it'll be worth it because you're getting paid so much better for the time, and you're getting better value out of the time because you're doing something that is meaningful.
Thank you. We would like to conclude our panel right here.